The total testing process is a guide for clinical testing that encompasses all the steps in provider-performed microscopy or PPM procedures. This video is intended for physicians and other individuals authorized to perform tests under a CLIA Certificate for PPM procedures. Remember, testing under the CLIA Certificate for PPM procedures is restricted to 9 examinations using bright field or phase contrast microscopy. They include wet mount preparations for the presence or absence of bacteria, fungi, parasites, and human cellular elements, potassium hydroxide (KOH) preparations, pinworm examinations, fern tests, postcoital direct qualitative examinations of vaginal or cervical mucus, urine sediment examinations, nasal smears for granulocytes, fecal leukocyte examinations, and qualitative semen analysis limited to the presence or absence of sperm and detection of motility. Activities you, the healthcare provider, will perform in the total testing process for PPM procedures include selecting tests and collecting specimens in the pre-analytic phase, performing tests in the analytic phase, and reporting results in the post-analytic phase. As you perform PPM procedures, the total testing process helps you avoid common errors, monitor quality, and comply with Clinical Laboratory Improvement Amendments of 1988, or CLIA, regulations. This video describes each phase and step of the total testing process for PPM procedures. Upon completion, you should understand how these steps relate to one another and how they apply to PPM procedures. By improving your understanding of PPM procedure requirements, you can ensure the accuracy and reliability of test results. The first phase in the total testing process is the pre-analytic phase. Studies indicate that most diagnostic errors occur during this phase. The pre-analytic phase includes steps to take before you test a patient specimen. The first step is the patient encounter. In this step, you will evaluate the patient and decide on the appropriate PPM procedure. One challenge during the pre-analytic phase is the potential for confusion about the correct specimen type required for each test. Review the test requirements to confirm the appropriate specimen type and volume required for the procedure. Ensure you have the correct specimen collection supplies. This is also a good time to make sure you have the required testing materials and equipment ready. The main equipment for PPM procedures is the microscope. When preparing for a PPM procedure, you must ensure you collect the correct patient specimen from the patient. This is vital to ensure accurate test results. Following best practices for specimen collection and handling is crucial to avoid errors. Contaminated or incorrectly collected specimens will impact the accuracy of the test results. You are responsible for accurately labeling and properly storing each specimen. Check the labels once more to verify that the patient's name and a unique patient identifier, such as the patient's date of birth, are listed. After you collect the specimen, you must ensure the patient information is correct and that the correct patient and specimen match the test being performed. In the analytic phase, you will perform the PPM procedure in your designated testing area. For each test type you perform, you should have access to procedure manuals for specimen preparation and testing. For PPM procedures that require specimen preparation, this activity is the initial step in the analytic phase. In this step, a portion of the patient specimen is prepared for testing. The procedure manual defines criteria for appropriate testing conditions for each type of test, including proper storage of reagents and other supplies, requirements for the equipment being used, and proper test result reporting. You should review the procedure manual as needed during specimen preparation and testing. The last step in the analytic phase is specimen testing. Follow the procedure manual when performing each designated PPM procedure. The test results will assist you in making diagnostic decisions. The post-analytic phase is the final phase in the total testing process. During the post-analytic phase, you will interpret and report the results of the PPM procedure according to your organization's reporting requirements. Accurate testing is essential for improving patient outcomes. The total testing process includes the pre-analytic, analytic, and post-analytic phases. It serves as a guide to ensure accurate results when performing PPM procedures. In review, the key components of the total testing process that affect patient outcomes include selecting the appropriate PPM procedure, collecting the correct specimen, performing the correct procedure, interpreting the results, reporting the results, and retrieving the results, if needed at a later time. To ensure accurate patient results, you must establish and follow procedures that comply with CLIA regulations and monitor quality to address potential errors in the testing process. The total testing process for PPM procedures must comply with the CLIA quality system requirements for PPM procedures.